Yeah, good morning. For those of you joining, we haven't got it started just yet. We're just waiting just another moment here. Thank you for your patience. Sorry for the delay, everybody. Just give us just a few more moments. Thank you. Okay. Can everybody hear me? I've given everybody just a thumbs up or yes in the chat. Okay, great. Thank you. We are going to start this session off with no cameras and no microphones to the participants. We're going to ask that you put your questions into chat or the Q&A functionality, and we will be moderating as we get started. My name is Amy. I'm the IT project manager for this project. We appreciate everybody taking time out of your busy schedules to join us today for this demo. We're going to get things kicked off with Joni from Access, and she's going to do a little introduction. We'll get started. Thank you.
Good morning. My name is Joni Masson, and I am the PASRR coordinator for Access. We are in the process of developing a web portal for our pre-admission screening and resident review program. The web portal will provide a streamlined approach to allow providers and external stakeholders the ability to submit Level 1 screenings and Level 2 evaluation requests, review Level 2 evaluation results, upload forms such as patient records and other required documentation, check the status of PASRRs, verify previous Level 2 evaluations, submit invoices, and query the PASRR database. So currently, Access has a manual submittal and review process via the PASRR email inbox, requiring the PASRR coordinators and external providers to engage in an email exchange of PASRR Level 1s and Level 2s. So this portal will allow the providers and external stakeholders to process the Level 1s electronically. And I do want to put in a side note. I just want to clarify that today's training is for the REBAs, like Mercy Care and Arizona Complete, who we are contracted with to perform the PASRR Level 2 evaluations. We are no longer doing the PASRR Level 2 evaluation requests manually. So this process is to train the REBAs, the psychiatrists, and medical directors on how to enter and submit the Level 2 evaluation via our new electronic system, the PASRR portal. We had some confusion in our last training, so I just wanted to just put that little clarification in. So if this does not apply to you, you are welcome to leave this webinar. Thank you, and I will go ahead and hand this over to Shri.
Thank you, Joni. Shri, when you're ready.
Yes. Hello, everyone. So I'll just quickly go ahead and share my screen. I will take you through the the life cycle of a particular level 2 evaluation. that is done by Psychiatrist and the REBA, group. So yeah, I'll just yeah. So I hope you're able to see my screen, and I will just quickly. So I have opened this link that we have. It is pointing to the Access Solution Center as we are calling it. And as soon as we just enter that, I'll just show you this your demo on the test instance that we have. And as soon as we put that link in, we will see that landing page. And this is the home page that we see. And this is the Access Solution Center and this will be kind of the primary portal that we'll be using for PASSR. Without further ado, one of the first things that we're gonna talk about is how to register yourselves onto this portal, and how do you create a login for yourselves, right? So the first thing is the first thing that jumps out to me is there are a bunch of things available over here, like the FAQs and everything. How do I create my account is that I will just create an account, click on this create an account button over here. And as soon as I click on that, I'll be able to see three options. For rebus and medical directors, they are they qualify as health plans for the system. So if you're a reba or a medical director, um you'll be required to put in the select the health plan say option over here. Now as soon as you do that, one of the first you'll be seeing a pop-up. One of the first the questions that you'll see over there is if you're aware of the health plans organization, a health plans registration code. This registration code will be given to you by like you know by Access, and I would say that this registration code is kind of important for you to go ahead and create an account that helps you map it directly. If I say no over here, you'll be given an alert that says you have to ask for your registration code. Only then you can create an account. So I'll just quickly go ahead and say yes over here and click on next. Now I see that it requires me to put a lot of information over here. I will go ahead and put in some information over here, like the first name, last name, email address, and all that stuff. Um, Let me just put in that. So what I can do over here is let's select um, our James Anderson, right? And James at example.com, and I'll just put some phone number. And this registration code that we're talking about, I have this on the background. So I'll just quickly go ahead and select something which is and right. And over here, we just go ahead and agree to the privacy policy and terms and conditions. You can just click on these, and it'll navigate you to the privacy policy and terms and conditions as well, but I'll just go ahead and agree to it. And a captcha is required for me to complete this. So once this captcha is completed, I will see the create account button to be visible. And I can just go ahead and click on create an account. So it just like gives me a bunch of info messages, one of which is the health plan account is created successfully. And there's an email that is triggered on the background to that particular email that was um, set. So I'll just quickly grab the email from the background, and I will just go ahead and quickly log into this, right? So like the account is created, it's just that you need to log in and change the password and all that stuff, like the first login. So yeah, right. So I'll just log in and over here we require multi-factor authentication after you change the password. This will be done by the authenticator app on your phone, and you will be required to um, scan this QR code in order for you to get the code periodically. So I'll just go ahead and scan this, and I see a code. I'll let it refresh. Yep. And I have logged in, and you will be able to see that um, the view is changed a little bit, and most importantly, you see this thing called your cases. Under your cases, you will see PASRR L2 cases, and this will help you. So whenever a new case is assigned to your group, you and your group, you will be able to see that under the PASRR L2 cases. So that was the health plan, registration part of it. So if somebody has any questions, I'll just, yeah, maybe you can answer that in the meantime. And
All right, let me take a look. I didn't see any other questions in the chat. Does anybody have any questions they want to put into the chat or the Q&A? If not, we'll have a formal Q&A at the end of the session, the end of the show back. Let's see.
all right.
There's
Do I go
one
ahead?
thing. There's one thing. Please go over the significance of this again. I'm not sure. So in the chat, there's information around we're changing our process from manual to digital. So anybody that'll be interacting with the level 2 forms for this process will need to be adopting this. Dr. Sweeney, we're going to be going over providers next. So the medical directors that are contracted with the health plans will register differently than a psychiatrist as a provider will register. Is that what you're ready for now, Shri?
That is correct.
Okay, we're going to move forward with that. Thank you.
Yep. So I'll just quickly go ahead and show you the registration part of how individual providers will be doing this. So I will go ahead and show you that in a different browser. So again, I will just come back to this GSP portal, the Access Solution Center, and I'll just click on this Enter site. I'll see the same thing, but instead of selecting health plans now, I'll select providers, right? So this will primarily be a like point for psychiatrists to come in and register themselves. So over here, when we are creating that account, you see provider over here, and you see like a bunch of questions, like two questions which say like, are you the rendering service provider, or uh, is your employer registered with Access or not, right? So based on these answers, like the creation of the things will change a little bit, the order of things will change a little bit, but it'll be still the same. Like you will still be creating an account for yourself. It's just that the if the provider is already created, I just need to select I represent the provider. Otherwise, I just have to select I am the rendering service provider. Um, so that is there. I'll just go ahead and click on I represent the provider for now. And I will say, is your for the question, is your employer registered with Access? I will say yes. So like the only difference between that yes and no is basically that the employer's access provider ID and tax ID will not be asked, and the system will just go ahead and check against the database and see if data is already present or not. Um, but the underlying process still stays the same. Because I have the data over here, I'm just able to input these provider IDs and all that stuff. So I'll just go ahead and do that. Let's select this. And I'll say Andrew Garfield. Um, uh-huh. And, and I'll just put some test data over here. The most important ones are the email, the name, and the employer's provider ID and the tax ID. Um, 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 Here I do the same thing. I just agree to the privacy policy and all that stuff. Um, Sometimes this captcha requires us to put in the select the um, images and all that stuff. So once I do that, an account is created and I will get an email on the back end. Let me just get the user ID and password, and now it'll be the same as what we saw for the health plan earlier, right? And I'm scanning this QR code. Once I scan this, I will be able to see a code being generated for me. If I'm not able to scan or anything like that, I will be able to put this code in as well. And this code will do the same thing as what we do for um, the QR code. Yep, so we log in. And for the providers, it's a little bit different because we'll be able to see the L1 cases as well, but like later on, you will be able to see the L2 cases once something is assigned to you. Once level 2 evaluation is assigned for your review. So so this is the provider registration part of it. This is how we register individual providers and provider representatives. Any questions before I jump into the demo of the life cycle of
There were some questions about health plans versus providers. I just wonder if we should pull up that crosswalk for their reference, or if we want to just verbally talk about that. So if you are a medical director that has to interact with a level 2 form, you will need to get the registration code from your REBA organization, Arizona Complete or Mercy Care. They will be distributing those registration codes only if you're a medical director. If you are a psychiatrist, you are recognized as a provider from the Access's point of view. So in that case, you would register as a provider, not as a health plan. If you're registering as a provider, you need to get the provider ID from the provider that you are contracted with. They will have that information for you. You need to reach out to that organization within the organization. If it's Banner Health, then you'll need to get that information from your contact at Banner Health. So hopefully that clarifies that for anybody. And we do have a user guide that will be posted to the website, as I mentioned in the chat, outlining that for you in the future.
All right. Without any further ado, I'll just go ahead and talk about. I'll just quickly switch gears into my own account, and this way we'll be able to see that see this particular level 2 evaluations in action. So I'll just quickly close those tabs. I don't want to confuse myself. And I will just quickly go ahead and log in as one of the rebus that we have set up. And actually, before that, let me just create this. Let me just create a level 2 request for us to for the rebus to take over. I'll just quickly stop sharing my screen. I'll come back for this. Um, all right. Um, so the one that I have created for now is 1057. I will just log in as
Shri, we can't see your
Tom.
screen if you're sharing.
Yes, I'm sharing right now.
Okay, perfect. Here it
So
is. Okay, wonderful.
yeah,
Thank you.
so I just logged in as Tom Cruise, and I will show you this from the Access Solution Center, because like the health plans at the psychiatrist will be having access to this only, and the agents will have a separate access and all that stuff. So as soon as we log in as Tom Cruise, Tom Cruise is one of the test users that we had created for the Reba, life cycle and everything like that for us to test and demo. So I'll just quickly go ahead and show you from here. So like as soon as we log in from here, we see this your cases and PASRR L2 cases. We just go ahead and see it. And because we were testing this, we had a bunch of records open. And I will just go ahead and select this 1057 that was created for us. And the goal is to take it forward from here, right? The um, So the first thing, the Reba, actually before coming over here, there are some emails that are triggered every now and then, because we want the Reba to know that this particular evaluation is needed, or like this L2 case is assigned to your group. So we have some emails triggering on the back end, and they will be able to see that this particular case, or this particular number record has been assigned to you, and there'll be instructions to navigate to this particular thing. So in that way, the Reba is always informed in the life cycle of this thing. And we just make sure that there is no communication lost between the system and the user. So one of the first instructions that we have for the Reba over here is to assign this to themselves, because we need somebody to take ownership of this particular um, record, right? So I'll just quickly go ahead and save it. I can scroll all the way down to save the form, or I can click on I can go onto my browser and just say Control S, and it'll save it. And over here, the next part is to um, assign a psychiatrist to this particular case, right? Um, I will just go ahead and select Benjamin Runkle for now. This is one of the test users that we've been using, and I will just say Control S. And I will put it a work in progress. So now, the thing is the Reba will identify a psychiatrist onto the case, and they will request info from the psychiatrist from here. What this will do is it'll change a couple of things on the form, because the Reba will not be able to edit any of these, and it is the psychiatrist's job to edit and submit all of this. We need the psychiatrist to be identified, and we request the evaluation from them, right? So all the way down, we see this button called Request Info from Psychiatrist. I'll just go ahead and select that. And what that'll do is it'll change the state of the record to inspection in progress. And it will make sure everything else is mandatory. I'll talk about that in a minute when I'm talking about psychiatrist's role. But yeah, like from here, like the psychiatrist just takes over the rebus, like evaluation perspective, and we just take it forward from there. Um, I will be um, logging in as the psychiatrist now, which is Benjamin Ronkel. And I'll go back to the GSP portal again, the Access Solution Center. Now, like a psychiatrist will be able to see both level one cases and level two cases. What we are concerned about right now is the level two cases. And we'll just open this 1057 that was created for us. Again, there is an email that is triggered for the psychiatrist to come here and look at this. And right off the bat, you'll see some of the fields are um, read only and all that stuff, but a lot of fields will be now editable. And most importantly, they require information to be selected on that particular field, right? And that means that it is required for submission and required to even save it, right? Some of the fields will already be carried over from the level one request when it is created. And but like most of the things will be the evaluation that the psychiatrist will submit. And um, even if I just go ahead and save this, I will be I'll just be thrown an error message that says like these fields are incomplete and I need to submit those, or submit all of that to save the form. um if you want to take a look at the level one form itself, where the level two form, yeah, level two psychiatric evaluation um started from, you can take a look at this through the eye icon now right next to the PASRR L1 number that we have. It'll just open up a pop-up that will outline what the PASSR level one request was, and the patient's information and all that stuff, right? Um, so there is that. And I will just quickly go ahead and start submitting all of this. So first of all, because there's a huge form and there's a lot of scroll, we have this functionality where we select the section that we want to answer, and we can just go one by one and go through that individually. But that is one of the things that we kind of reduce the scroll on, and it kind of makes it kind of interactive on a user experience perspective. So I'll just go ahead and fill all of this. I know there's a lot of fields, but please bear with me on this. And with fields like this date picker, of course, you can just type it down in this format itself. But sometimes the system kind of acts weird and maybe does not like it. So the best practice is to um, select the date from here itself. And for some of the fields, you'll be able to see that there are help texts around. So for the date of most recent physical examination, obviously the physical examination that we're talking about should always be in the past, right? So it should not be in the future. So we have some validations over there as well. So if we select something like this, it'll just clear it out and say the date cannot be in the future, right? So I'll just select something in the past and go ahead. For now, I'll just go ahead and submit only the ones that are mandatory. And as I'm, selecting this, for example, the medication administration and all that stuff, like if I select this, the required information from here just goes away as well. So one by one, they just get knocked out, and I will be basically going through the whole form and putting in all the required information, right? Even if I just save it, like there, it won't let me save it if even if I'm on a different section. So there's some other functionalities that we've put in. For example, there are some facial expressions that that does not describe accurately what is going on. So we have this option to select other, and there is a description that that we can put in. So, there's a lot of fields with that. So, what we've tried to do there is we've made sure that all these fields are, dependent on. It's like the fields that are dependent on each other. We will just make sure that, um, we don't show those fields directly. It is just that um, we make sure we show what is necessary and nothing else in order for us to keep the form kind of short. We don't want to overwhelm everybody by doing this. So that was the thinking behind it. And honestly, I would think it kind of makes it better than what we have on the paper. Of course, it's going to take some time to get used to it, but we think this is going to save a lot of time and effort for a lot of people. And we come to the last section over here, which is the signature section. So I will just go ahead and select the name and date and all that stuff. It'll be today's date. And any other remarks, I'll just put something. And I can just go ahead and save this. And there is a couple of other functionality that we want to show you. One is the current medications and one is the DSM-5 diagnoses. So both of them behave the same way. It is just that there are two different tables that we're looking at. So the current medications, as the name suggests, it's like the list of current medications that we want to highlight for this particular patient. So I'll just, and as soon as I selected on that current medications, it'll open up a new tab for me and go through the list of everything. And save this. So I can just go back and add more if I want. If I want to edit this, I can just select this and the edit pops up over here. So there is that functionality, and the DSM-5 diagnosis is like the same thing that it follows the same thing the current medications list, right? And so there is that. If I don't see the number popping up over here next to the current medications, I can just refresh it, and it automatically just takes in whatever number it was, right? So let's say like my as in the psychiatrist's evaluation is done, and I want to send it back to the REBA, right? So what I can do is I can come all the way down and make sure all of this is saved, and click on the submit evaluation button. When I click on the submit evaluation button, it'll take some time to save all of it because there's a lot of updation that is happening. But once that record is updated, we see that these fields are now non-editable, and we won't be able to select any of it over here. And the psychiatrist part is done, and we won't be able to save it as well. So now the Reba will get an email that says the evaluation is completed by doctor, and it will be the Reba's role now, which is Tom Cruise, to take over that level 2 case or the level 2 record, and get it certified by a medical director. The medical directors are typically part of the same Reba group, and they will be looking forward to certifying the evaluation that is performed by a psychiatrist, right? So if there is some information that is required by the psychiatrist, and some more information that is required, for example, the neurological system is not filled in and all that stuff, and you need it kind of thing, you can always request info from psychiatrist again. It's a loop from there. So you keep going back and forth if you need it, and till the information is all submitted, right? Um, I will just go ahead and talk about the next steps after the information is all populated on this particular record, which is identifying the medical director and getting it certified. So I'll just go ahead and select the medical director, which would be Rebecca Ferguson for now. I can just select the person from the REBA group, and go ahead and save this. So I just have this saved, and if I scroll down, I can see this button, a new button called Request Approval. What this will do is it will request the approval from the medical director, and the medical director will get an email that says that tells them about what to do, and the approval process will kick in from there. That is for certification, and it is kind of important in a way that the invoice is generated from there, and it is important for the certification to happen based on the evaluation that is done by the psychiatrist. So I'll just log in as the medical director now. Again, the medical director can come to the GSP portal or the Access Solution Center, and come to the level 2 cases, and scroll to the one that we have, or they get an email with the same thing as well. So we don't need to worry about all that. And the um, medical director has some heightened abilities in a way that they will be able to edit the fields that the psychiatrist has submitted, right? The evaluation. If there is more information that is needed from the psychiatrist, I can request info from the psychiatrist again. If not, I can just go ahead and approve or reject this particular evaluation. If I reject it, it'll go back to the REBA, and they can just coordinate between themselves to talk about what is needed on this thing and all that stuff. If we identify that this is we can certify this, of course, we can just go ahead and put all the fields that are required. In this case, it's the authorized signer, the date that we're doing this on, and the title, right? And this contractor certification is kind of important for the invoice to be automatically generated. And the invoice will be generated by the system after the PASRR like coordinator just takes over. So I can just save the information over here and let it be. Or I can just go ahead and approve this as well. So I'll let the record just update. I'm not sure why it did not, but yeah, okay. And I will just go ahead and all right. So I'll just go ahead and approve this. What this will do is the medical director has now certified it, and it will trigger an email to the passer agent to take over the case and do any decisions that are needed for the case to go forward. So over here, the life cycle of the level 2 case from the REBA's perspective, REBA, the psychiatrist and the medical director's perspective, ends over here. And from here, the passer agents takes over. So this would conclude that part of the demo. And I will just hand it back to Amy and Joni and team. Thank you.
Thank you, Shri. We've been answering questions in the chat, and I appreciate everybody's engagement. I'm going to go ahead and take the attendees off mute. Just give me a moment to navigate my system here. Okay, mics should be activated, and we can go into Q&A if anybody's got any questions.
Hi, this is Dr. Sweeney. Couple questions. What are the timelines involved? Could you just explain the process of how long we would have after being notified that a PASRR was due? And is the PASRR assigned to a individual psychiatrist by the RBHA, or do I, as the medical director, assign it to an individual psychiatrist?
So I can take this question, Amy. So the psychiatrist will be assigned the case, the level 2, evaluation by a RBHA, not a medical director. The medical director certification only comes after the evaluation of the psychiatrist.
Okay, so I'm sort of like quality control. I read over it to make sure that it's complete and makes sense and answers the questions. Is that?
Yes. Yes.
Okay.
So like you just as the medical director, you will just go through the entire form and see how the level 2 evaluation has been answered. If there is any more information that is needed from the psychiatrist, you can just click on the request info from the psychiatrist, and it'll let the psychiatrist know. And but you can just reject it and let the RBHA take it over as well. So there are a couple of ways you can do it, but that is the that would be the life cycle or the process that we that I would recommend.
And how will I know that there is a PASRR waiting for my review? Do I get notified that someone in my agency has done a PASRR? Or do they
Yes,
have to tell me?
You will be you will be receiving an email every now and then. So if you're assigned as a medical director for this particular evaluation, then you will be receiving a separate email that says that gives you the information as to how to approve and reject. If you're a part of the psychiatrist, every time the psychiatrist is required for submitting the evaluation again, they will be getting that email. So every now and then, for every scenario, we trigger emails to them saying, this is the particular level 2 evaluation that is needed from you and all that stuff.
Okay. And then once the psychiatrist receives the notification that they have to do a PASRR, how long do they have to do the PASRR to complete it?
I will defer that question to Joni and team.
If it's coming from a hospital, it's still the typical 3 days. If the request is coming from a nursing facility, it would be 5 days.
And will we get contact information? Like, say I get told that there's a person at a Banner hospital, just how do I arrange the evaluation? Will I get some information, or do I have to do all that legwork myself?
No, typically what I do is, for instance, for Arizona Complete, I will send the information to Cindy and her team with the contact info, of course, the patient's name, the contact information of the person who submitted the level 1, the social worker, their email address, and address.
Okay,
I'm sorry, their phone number.
Okay, and then this can be done, I hope, by telemedicine, this evaluation.
Correct, yes.
Okay, but we only have 3 days to do it?
Or a hospital, if they're inpatient in a hospital.
Okay, and then 5 days if they're actually in the nursing facility.
Correct.
That's business days.
Yes.
Okay, and that was a pretty extensive form. Do we get reimbursed for that? Well, how does reimbursement work? Like, does the prescriber get reimbursed, or does the agency? Did I get muted?
I know, Cindy, did you have your hand up for that question, or?
No, I actually had my hand up prior to Dr. Sweeney asking about how he would review these PASRRs that the prescribers are doing. So, Dr. Sweeney, was that your number one first question?
Yeah.
If you were going to be reviewing what the psychiatrist had submitted?
Yes, ma'am.
Okay, so can I make a little bit of some clarification on that?
Sure.
Okay, so what happens is when Joni sends me the level 2 request, I then look through my contact sheet of providers and see who, I try to keep it closer to the area, even though we're using telehealth. If I don't find availability, then I reach out to another provider, right? And I just kind of like try to spread the wealth amongst everybody. So one person's not being inundated with these level 2s, first of all. So this is going to be what I'm going to be talking about is the old process, but you could probably connect it now to the new one. Just pretend it's the portal. Okay. So when I get this in from Joni, I will find a provider. I reach out to the office administrator point of contact for that organization. And since you're with SBH, correct, Dr. Sweeney?
Yes, ma'am.
Yes. So I would reach out to, say, pacing, right? I would reach out to the pacing person that I have on my contact list and say, hey, I've got a PASRR, yada, yada, yada. Here's the level 1 that's attached to it, with all the information about that member, their demographics, the point of contact for who they can set up that scheduling with to get the L2 done, what the due date is to me, because I have to get it to access on day 5. Okay. So with that being said, then that point of contact at the office then says, hey, yep, we got it scheduled with this provider. Then that provider goes and they do their thing, completes the assessment. The assessment then will be returned to me by either a provider or that office administrator. I will
Okay.
then review it, making sure everything is there, I's are dotted, T's are crossed, you know, all that good stuff. If there's any issues, I send it back saying, hey, please address this question, page 10, whatever it is. If there's nothing wrong with it, then I send it over and to my medical director on call here at the REBA. Okay. They will review it. They will sign off on an invoice that I create with that provider's name. Then I submit it internally to a system that we have. My supervisor reviews it. They then approve it. They send it to RegOps team. RegOps team then looks at it and they send it over to Joni. So, and then at the beginning of the following month, I would submit invoices for those particular providers that have done those specific evals on what date with what member.
Okay.
And then they would be paid.
Okay.
Now,
So they're
go ahead.
paid individually.
Yes. Yes.
Okay.
Yes. And so with this new system, there's still going to be some emails, right? Because we have to make sure that the person that I submit this portal request of L22 is going to be in the office. Because
Right.
as we found out on Wednesday and here, we're not going to know. Okay, so if Joni sends me something on, you know, Joe Smith, and I see, okay, oh, yep, we got a PASRR, I need to assign it to a provider. I pick, I pick Dr. Mark in Kingman, right? And I click on his name, I submit it to him, he'll get an email notification. Well, you know, I have no idea if it's going to come back out of office. So what I'm going to be doing is sending an email to that provider's contact at the office saying, hey, just submitted an access, L2 request through the portal. Due date is this, let me know if this person's in office, blah, blah, blah. Does that make sense?
Yes, it does. Do you have that information already, all those contact points, or do we need to provide that to you?
So I already started reaching out a while back, and I've been working with your L&D team, and I've got those spreadsheets for every single outpatient for SBH.
Okay.
So
All right.
I know who's what, I have everybody's information.
Okay. And who is
so-
your counterpart at Mercy Care? Because you're with Care First, correct?
Oh, well, Arizona Complete Health now.
Arizona Complete, right?
Mhm.
Yes.
Yes.
But-
with Mercy Care, I'm not sure, Joni, who that is.
They have another group that they contract with. I think it's DMG.
Okay, so they will not ask us, Mercy Care will not ask us to do any PASRRs, as far as you know.
No, unless you work for DMG.
No, I don't. Okay,
Okay.
that's a relief. Thank you. Okay.
So then, Dr. Sweeney, just to shorten this up here, you're not going to get a notification to look at what your provider did, because
Got it.
after in the portal, they're going to send it back, right? I'll get a notification. Correct me if I'm wrong. Keep me honest here, Joni and Amy, but I'll get that notification that it was turned in to the portal.
Shri, would she get a notification on that?
As the PASRR coordinator?
Yes.
Okay,
Yes.
yeah, that's what I was thinking. Yep. And so I'll get that notification. I'm going to need to assign it to a medical director that's on call that day that it gets turned in. So I would look at my on-call list for my medical directors at the REBA here at Arizona Complete Health and say, like, Trudy Dawkins here on call. I would then put her name in the portal in that spot, and then she would get a notification that she needs to go in, review, and approve to sign off. Because after that is done, that is when it would be turned back into Joni. And Joni, correct me if I'm wrong again, after you look at it and review it, then is when invoice is automatically submitted. Is that correct?
Yes.
And
Okay,
so,
all right. So the medical director isn't me. The medical director is
No.
a RBHA medical director.
correct.
Okay. Tell Trudy I said hi. She's a wonderful person. So.
All right. So, yep, I just want to make sure that was clear on your end, Dr. Sweeney, because I seen you here on the call and I know you're with SBH, and I did not want that to be confused moving forward. You would not be contacted to approve anything from your providers.
Sounds good. Thank you.
You're welcome.
Thank you, Cindy.
Sure, Joni.
Yeah, great discussion. Thank you, everybody. I appreciate that. Oh, Trudy's on the call. Says hi. Okay, wonderful, wonderful. Any other overall questions or insights about the new portal or the process? I just wanted to call out that I did put out there, we did answer a couple questions about communications. Cindy, I know I've got an email from you I haven't responded to yet. I apologize. We're getting put together, but essentially the communications should be going out by end of business today, so keep your eye out for that. And then as the videos here, the webinars become available, they will be posted. And there will be instructions in the communication coming out today. We've also updated, working on getting the website updated. I didn't say past tense, working on getting the website updated today as well. So just keep an eye out for that, and all the information will be on the website.
And when is this going to start?
So we are going to be launching, it'll be consumable for everybody in the environment on November 14th at 8 a.m.
November 14th. Wow. Okay.
Next week.
Yes.
Yeah. So all of the communications are coming to the website, also through the associations, also to the coordinators that we do have direct contact with, including Cindy. The mailbox that you guys normally communicate with now currently has a notification to let everybody know that this change is coming, taking you over to the website, and that's where you're going to get all your user guides and the training videos when those are available, and so on and so forth. So everything will be consolidated to that one website. So that'll kind of be your source of truth. Jennifer, you go ahead. If you're talking, you're on mute. Jennifer?
Jennifer Kerr.
Okay, just sorry. One quick question.
Oh,
So as a provider,
there you
we
go.
need to go once we get our password, log on and just wait for something to be assigned to us. Is that what I'm understanding?
I'm sorry, could you repeat that?
So as a provider today, what do I need to do? Do we need to get the password and just create an account, and then we don't do anything until we're assigned something? Is that right?
Are you acting as like a provider psychiatrist or medical
Yes,
director
yes,
health?
as a provider.
Yep. So again, those instructions are going to be getting posted between the end of business today and Monday morning. And there is a user guide out there based on the demo that this gentleman just did for us. Okay. And you can go ahead and start making the contacts within your provider organization for that provider ID and tax ID that you're going to need, and start getting set up. But you will not see any of these forms to consume or be able to, perform any of these duties until November 14th at 8 a.m. That is when we actually go live and launch. But that won't delay you from beginning your registration process. So we will urge you to keep an eye on the website, making sure you're looking for those user guides, get the user guides, review those. And if you can, work towards getting, set up as your login account before the 14th. That's doable. Just please keep in mind that you won't see anything there at this point. You'll just be able to register your account. But you can definitely start those conversations within your organization to get the information that you need to create those accounts. Hopefully that helps. Does that clarify?
Yes, that's what I thought. I just wanted to make sure. Thank you.
100%. Great. Thank you. Good question. Cindy's got a question for Jennifer. What organization are you with? If you don't mind sharing.
Southwest Behavioral Health.
Okay, thanks, Jennifer. What I'm also going to be doing too is after I get this communication from Amy at the end of the day, depending on what time it's sent out, either this afternoon or on Tuesday, because we're closed on Monday, is I'm going to send out the same information to each of my administrative point of contacts to the organizations, reminding them as well to make sure that they're getting everybody registered and making sure they understand that we go live on the 14th and all that good stuff. So I'll be doing that too on my end.
Cindy, just so I know, who is your point of contact at Southwest?
It depends on the outpatient, but I have been talking to Sandra Solarno, is Solarno. She's an L&D.
Yeah.
Yeah.
Okay.
Anything else? Okay, I will take silence as a no, and I want to again communicate my appreciation to everybody coming and sharing. Great conversation today. Again, just keep looking on our PASRR website. It's posted in the chat here, and we'll be looking to launch next week. It's an exciting new opportunity. Thank you, everybody.
Thank you.
Thank you so much.
Yep. Bye-bye.
Welcome, Cindy. Take care.
Thanks.